Hi, my name is Carla Campos, and I'll be talking about the functional anatomy of tail regeneration in the California Alligator Lizard, Elgaria multicarinata. I'll start with what is autotomy. Autotomy is a form of self-amputation. Evolution has seen many organisms develop this. They usually develop it as a way of anti-predation, so getting away from their predators. For example, lizards will detach their tails if they sense that a predator will be nearby, and if the effort of detaching the tail is better than not detaching it. Because regenerating a whole new appendage is very costly. These lizards have to be able to regenerate muscles and compositional structures that still allow some of the movement they had before with their original tails. How it's done. Tails have been seen to have these fracture planes, which are small breaks in the vertebrae that allow for detachment when needed. The muscles contract and break those pieces, and therefore the tail detaches. There are sphincter muscles close to the tail that prevent any blood loss, so the lizards don't bleed out. And then afterwards, the wound is fast healed and sealed. Regeneration often takes a few weeks to months, therefore again emphasizing how costly it can be. Regeneration. There is something that happens when the tail regenerates. They don't regenerate the vertebrae again. Bone is not regenerated. Instead, it's replaced by this cartilaginous rod as seen in this image. They also regenerate their muscle, spinal cord, and vasculature. Again, this is very costly. Literature has shown that some lizards regenerate more fat ratios than muscle ratios, as seen here with the leopard gecko. You can see the original tail to the new regenerated tail, which is much chunkier than the other. So why the California alligator lizard? Unlike the leopard gecko, as I previously shown, the alligator lizard is arboreal. It lives in trees, lives in shrubs, and therefore needs its tail for more movements than some other lizards. Its tail is capable of prehensile capabilities, which is grasping. And also the California alligator lizard, it's known for its osteoderms, which are scaly bones. All this information is really important because it's going to be used and translated into biomedical clinical applications for regenerative medicine or prosthetics. Our questions and our goals. Our question is, what's the difference in the muscle mass, bone mass, structures, relative and movement capabilities in the original versus the regenerated tail? We want to understand these simplified structures. We want to quantify in detail the three-dimensional differences in the bone and the muscles using museum specimens specifically. This will help us determine how muscles are attached to these cartilaginous rods. Our hypothesis is that the tails maintain enough muscle, mass, bone, and structures that still maintain the movement. In order to do this, and our rationale behind this is that they have to have the muscles that allow movement, grasping, and enough neuromuscular control to do those movements as well, along with their osteoderms regenerating with sufficient volume for sufficient protection. And overall, that the regenerated alligator lizard tail must be functional beyond storage fat seen in leopard geckos. Our methods included obtaining museum specimen for the California Academy of Science herpetology collection. Our digital dissections were done using Amira software. Our lizards were micro CT scanned, both skeletal and stained. For the stained, we use the dye-CT procedure, which uses iodine to stain the soft tissue in order to enhance its contrast when we're looking at COVID and unforeseen complications in scanning the tails. Our results are still limited and preliminary. Thus far, our most salient observations have been that regenerated tails are simple relative to the original tails. There is a cartilaginous rod that replaces the vertebrae, and the osteoderms are smaller and less dense than original, and from physical appearance, they are different in coloration and pattern. We were also able to identify foramina throughout the cartilaginous rods, as seen here in this bottom right-hand image. Foramina are openings that allow blood vessels, nerves, and other support systems, which would make sense as to why they're found throughout the rod, relating back to our rationale about neuromuscular control. It's also seen up here in the image in a transverse segmentation. We were also able to identify some chevron-shaped muscles in original and regenerated tails, with differences in consistent size and the amount of muscle that is seen throughout the tail. This correlates to previous literature on regenerated and original tails. From a transverse section of the scans, it can be seen that original tails have fewer but larger and more organized muscles versus the regenerated tails that have smaller and more separated and less organized muscle compositions. This is equivalent to observations and patterns seen in literature and other lizard species. Going forward, we would like to continue perfecting our segmentations in terms of accuracy and precision and collecting quantitative data. Right now, we're focusing on segmenting the muscle mass and analyzation of the osteoderm volumes. In the future, we would like to add a gross anatomy and histology portion to enhance our analysis of the California alligator lizard muscular and osseous composition of original and regenerated tails. And overall, I'd like to emphasize how important this work is in terms of being able to use it for future studies and translating what we found into prosthetics and other biomimicry. I'd like to acknowledge Dr. Clint Collins, my PI, Dr. Haley O'Brien for helping us with Amira, Lauren Schrimberg at the Cal Academy of Science, Herpetology Collection, Manon Wilson at the University of Arkansas MicroZT Center, my lab partner Marissa Correa, and the NIH RISE Research Scholar Program for funding this. Thank you, and I look forward to your questions.